So thank you, Bruce, and the organizers for giving me a chance to talk about a topic that I believe is so important to us and to the future of our society. So let me start with an audience response question. How many of you would like your own primary care physician to do well, to grow and flourish, and continue to provide you excellent care? Yeah, well, we're seeing that become a more and more challenging activity today because we see the toll of stress and workload on physicians, and we see nurses and physicians all too often being stressed beyond the breaking point to the point where it really affects their ability to deliver care. So we're going to talk about how we can help physicians grow and flourish in medicine. And from my perspective as a pediatric residency program director, there's no better group to focus on to promote growth and flourishing than our young doctors that are just taking off in the field. So let me tell you a story. This is an actual picture of an emergency room physician. This young man had been at work for 16 hours, filling in for a sick colleague, been taking care of sick patients all day long, saw a patient with bruises diagnosed with child abuse, saw a 50-year-old man, the same age as his father, who is now in the ICU intubated after a massive MI, and he just lost a 19-year-old man in a motor vehicle accident, despite all of his ministrations. And this emergency room doctor had to go outside for a few minutes and collect himself. And 10 minutes later, you know what? The ER's full of patients. He stands upright, he walks back in, and guess what? He walks in to see your child. So how well do you think this physician's going to be able to empathize and communicate with you? How well do you think he's going to be able to care after what he just experienced? So we know that burnout is affecting an increasing number of our healthcare professionals, and certainly doctors are not immune to burnout. And we know that burnout jeopardizes the ability of physicians to care and also their ability of physicians to deliver care. We recognize burnout in individuals when they are challenged with their ability to continue to be emotionally connected and start to develop what's called emotional exhaustion. They begin to be challenged in keeping the personalization and personal touch with their patients and begin to succumb to depersonalization, and ultimately struggle with trying to keep a sense of why they're doing what they're doing, their sense of personal accomplishment. We know now that a large percentage of our physicians are suffering from burnout, and we know that this has negative consequences for our patients. What happens when a physician burns out? Well, I can tell you nothing good comes of it. And there's ample data now that says that patients that see a burned out physician have less effective communication. They are less satisfied. Those physicians have a greater incidence of delayed and misdiagnoses. And those physicians that are burned out report that they're more distressed. They recognize that they're more prone to error. They recognize that the interactions they have with families and patients are challenged. And ultimately, these physicians that are burned out begin to have problems with relationships in their own personal life, and they begin to struggle with connecting with their true purpose. And they have a higher incidence of dropping out of clinical care. So why is this burnout happening? So let me tell you from my perspective, I've been a physician for 40 years and a program director for 27 years. I've graduated over 1,000 pediatric residents, and I think most of my colleagues would say that I'm probably the antithesis of burnout. I love my job. I love what I get a chance to do. It's a privilege to be able to help families when they need help and to be able to come into their lives and be a service. And my program director colleagues and I, 6-7 years ago, were just struck with how many of our residents just seem to be losing their joy and were stressed and having trouble with simple kinds of connections and caring. And as we heard these stories, we thought, what's going on here? And it really caused us to take a step back and say, is there something going on with our resident physicians? Or there's something that is beginning to affect their ability to withstand the kinds of things that young physicians deal with? Sick patients, busy workloads, patients that have bad outcomes despite all the important things that you can do, patients that have bad outcomes because things are missed, and just the demands of being in this very personal environment. And what we learned when we did our first series of the classic Maslow burnout inventory with our pediatric residents was 30% were burned out. We thought, this is crazy. 30% of doctors in this lovely Midwestern college town, collegial atmosphere, nice place are burned out. And as we've measured it yearly, what we've seen is we now hit over 60% of our first-year residents telling us by the middle of the year that they don't know how they're going to be able to take it any longer. So we have significant problems, and we recognize that we need to address this in a more thoughtful way. Because if this is what the young folks starting out are feeling, where is this going to lead? We also know that we're not alone. We just finished a study with a consortium that I co-direct with Manish Batra from Seattle Children's Hospital, where over 1,800 pediatric residents in the United States did a series of surveys, and it turns out that 55% of the pediatric residents at these 30 centers are burned out. And oh, by the way, Nationwide Children's is lovely. We're 60%. So we have a problem, and we could choose to ignore it. We could choose to say, well, let's just hire stronger, better people. But this data suggests that there are systemic issues, and that we need to address it in ways that really help our young physicians grow and flourish, and not ignore this any longer. So when you look at burnout across disciplines, it turns out it's not just high-stress disciplines like emergency medicine. All of the disciplines have high levels of burnout, and in most cases, in red, the 2017 data, it's increasing, and it's in the range of 50 to 60%. And when you look at what causes burnout, when you talk to the physicians, the best way to phrase it is death by 1,000 paper cuts. So in this list, 0 to 6, 6 being the most important in terms of causing stress and burnout endorsed by physicians, look at the bottom 4. Increasing electronic health record demands, feeling like a cog in a wheel, spending too many hours at work, and bureaucratic overload. I've yet to meet a resident or a attending physician that says, I want to spend more hours at work. They're spending hours at work because patients need them, and our systems are demanding it. So death by 1,000 paper cuts. Well, one of the big things we recognize when we think about what we can do about this is we have to really think of the conceptual framework. And we've characterized the causes of burnout in sort of 3 major domains. The first domain is systems issues. Again, as these physicians talked about, regulations, electronic health record, these bureaucratic demands. At a second level, or second domain, there's the micro environment, the local environment, the people you work with, the culture of the group, and in the hospital setting, the floor you're working on. That has a major impact on stress and how people do. But we've also recognized that there are personal resources and personal characteristics, because although I've talked to you about 50 to 60% of physicians are burned out, 40 to 50% are not. They're in the same environment, they're dealing with the same stresses, and they're maintaining their energy and their passion and their ability to bounce back from adversity. So there is something there that we need to focus on, and we've really worked on looking at what works for individuals and how can we focus on the positive aspects of developing personal resources to withstand these difficult environments we work in. Now, that's not to neglect the systems issues, and when we talk with our residents, we say the systems issues are real, we need to work together on those. It's not going to be easy, but tonight you can do something that helps your health, that builds your resources, that can allow you to be more resilient as you work through this important passion and calling that you have. So we talk about developing resilience in our young physicians. And when we talk about that, it really is pretty simple. It's partly understanding when you're stressed and burned out, And then it's developing two sets of behaviors or habits. The first one, as we say, is not rocket science, but our residents so frequently forget about self-care. Are you sleeping enough? Are you doing some fun things out of work? Are you eating a healthy diet? Are you exercising? Are you attending to your inner life, whatever that be? Simple things that get lost in the maelstrom. We've also come to recognize that, as Marty Seligman and his colleagues at Penn have talked about, is that humans go for greater purpose. It's not just, to be happy and to be and do fun, but well-being is a crucial part that helps define our ability to thrive and grow. And as Seligman and his colleagues have refined this model, they've really identified 5 different areas of well-being. One is you got to do things that are fun, that give you joy. It helps if you do things that really you get lost in, that you enjoy so much, it's almost like time stands still. Relationships are an important part of well-being. And again, many of our residents get so caught up in work that they forget to tend to those important relationships. And then lastly, recognizing the meaning of what you're about on this earth, and then the accomplishments that you're able to have. And we recognize that developing these resilient skills in our residents takes time, takes attention, and when we believe that developing mindfulness about these habits and the ability to actually practice them is a large part of this. So let me tell you my story about mindfulness. So I was raised Catholic, the usual doses of guilt and prayer, and kind of fell away from spirituality in my 20s like most intellectual Catholics. And I remember as a pediatric resident seeing children at the University of Minnesota coming in with asthma and doing relaxation visual imagery and turning off their asthma before we could even give them a shot of epinephrine. And it was like, wow, what's going on here? And I was always intrigued with this mind-body stuff. About 20 years ago, I thought this would be good to be a little bit more thoughtful and at peace, and I got into a self-meditation process by a guy named S. Warren, and that worked for a few months and then fell away. 8 years ago, I signed up for a mindfulness-based stress reduction course, 8 weeks, 3 hours a week, homework in between, practice, and it really took. And I could really find myself being more mindful, less reactive, ability to be centered, ability to feel good and be grateful. Even my wife noticed that. And I'll tell you, it's nothing like having these skills when you need it. Because 3 years ago, I was diagnosed with a grade 3, stage 3 B-cell lymphoma, and had to go through therapy. And I can tell you, having these mindfulness skills to be able to rely on when I really needed it, and to be able to stay centered, and to stay positive, and to deal with the stresses and come out stronger. I couldn't have done it without having those skills ahead of time. I could not have learned those skills in the midst of that crisis. And my kids, my wife were like, how are you staying so positive? And it's like, well, because that's what I need to do. And I'm practicing doing that every day. And every time I especially need it, I have a way to do that. And it really brought home that this is what we need to develop in our physicians, this ability to be mindful, to be appreciative, grateful, to withstand stress, to see greater purpose. So let me just briefly talk to you about 2 things that we are doing now to try to develop the self-care and mindfulness of our residents. One is a simple technique. It's actually an online series of mind-body modules called STREAM at Ohio State, a program Kathy Kemper developed. 12 one-hour modules that bring you through all kinds of different mindfulness techniques and meditation, autogenic training. And we have conducted studies and published showing that in trainees doing as little as 2 hours, 2 modules, reduces their stress and burnout over 3 to 6 months compared to those that get randomized to non-mindfulness modules. 2 hours. So this really shows me that even little bits of engagement can improve the ability of our young professionals to deal with the stressful careers they've signed up for. Another example is something that one of our collaborators, Mariana Claude at OSU, calls low-dose mindfulness-based stress reduction. This is a 4-week course, an hour and a half each week, 1 module you do online before you come in and practice. In this pilot study directed by one of our med-peds residents, Laura Romchevik, 10 residents participated, and it was amazing. They had a 25% decrease in burnout over 3 to 6 months, and it lasted. And they also had a 28% improvement in their resilience through this short dose of mindfulness work. And as we talked to these individuals 6 months later, they were still doing parts of this. They were still finding that this helped them in their daily lives and in their professional work. So there's a lot more we can do, and we believe that this is an area where we need to continue to work, collaborate with others. Our consortium is working on developing some national projects to develop evidence for what are the best ways to develop personal skills and develop resilient young physicians. We have a crisis, and I don't want a doctor taking care of me that can't connect, that's not present, that's not listening, and it's not caring. And I'm sure as you started out this presentation, you don't want that either. So we are going to work on systems issues, we are going to attend to the local environment, but in particular, we're going to work on developing these resilient skills in our young physicians. And I believe that's the way we're going to be able to safeguard them and really have them deliver on their promise, which is to take care of all of us to the best of their ability. Thank you.